The U.S. has no universal health care. According to the Congressional Budget Office, nearly 26 million Americans remain uninsured. Across the rest of the world, healthcare is very different. Some European countries have publicly funded healthcare, like the UK's National Health Service. In Japan, insurance is often provided by the employer and medical fees are regulated. In the US, it costs around $9,500 a year for healthcare. 17% of US GDP is spent on both private and public healthcare, more than any other developed country in the world. Sweden spent just under 12%, while the UK is much lower at 9%. However, a mere 48% of that expenditure comes from the government, while Sweden, Japan, and the UK all spend more than 80%. If the US spends more of its GDP on healthcare, surely it should be better, right? Well, according to data from the World Bank, the life expectancy of Americans has not improved as much as those living in other developed nations. With a life expectancy of 79.3 years, Americans live shorter lives than people in 30 other countries. The number of hospital beds available is another way of measuring the capacity and quality of resources a healthcare system is able to provide. Once again, the U.S. fares poorly compared to other developed nations, with just 2.83 hospital beds for every 1,000 people. And one final damning statistic, the United States is the only industrialized country in the world to offer no statutory entitlement to paid maternity leave.